Cognitive and neurological improvements have been observed in patients following cranioplasty, but the physiological mechanisms behind this recovery remain poorly understood. One major hypothesis is that restoring the skull structure not only protects the brain, but also improves cerebral blood flow and normalizes intracranial pressure. These improvements in perfusion dynamics may contribute to functional recovery. Shown here is a 3D reconstruction of a craniectomy defect and patient-specific implant. In panel A, we see the open cranial defect after surgery. Panel B shows the titanium framework with adjustable fixation arms designed to fit the defect. And panel C demonstrates how a calcium phosphate implant is integrated into that titanium structure to restore the skull's anatomy. This structural restoration may also help restore vascular and metabolic function in the affected hemisphere, a hypothesis we investigated using quantitative MRI. Our primary goal was to evaluate cerebral perfusion and barrier dynamics in patients before and after cranioplasty. We used advanced MRI techniques to quantify cerebral blood flow, arterial transit time, and blood-brain barrier water exchange rate. We focused on differences between the impacted and non-impacted hemispheres, particularly within specific vascular territories. We hypothesized that cranioplasty would lead to improved perfusion and water exchange in the affected hemisphere, reflecting mechanisms of neurological recovery. We conducted a longitudinal study of 14 patients undergoing cranioplasty. The average age was 33.4 years, with 2 females and 12 males. Imaging was performed on a 3T Siemens Prisma scanner using a 64-channel head coil. For structural imaging, we used a T1-weighted MPRAGE sequence with 1 mm isotropic resolution. Perfusion imaging was done using a 3D diffusion-prepared pseudo-continuous arterial spin labeling sequence, or DP-pCASL. Acquisition parameters included a TR of 4,000 milliseconds, TE of 36.5 milliseconds, a 224 mm field of view, and spatial resolution of 3.5 by 3.5 by 8 cubic millimeters. The post-labeling delay was 1800 milliseconds, and the labeling duration was 1500 milliseconds. Diffusion preparation used b-values of 0 and 50. These methods are based on the work by Shao et al., published in Magnetic Resonance and Medicine in 2019. The MRI data were processed using the Laboratory of Functional MRI Technologies BBB Water Exchange Toolbox in MATLAB. We analyzed regional values of cerebral blood flow, arterial transit time, and blood-brain barrier water exchange in the ipsilateral and contralateral hemispheres across the leptomeningeal MCA, PCA, and ACA territories, as well as the MCA perforator region. KW was calculated using a total generalized variation regularized single-pass approximation model that incorporates ATT and T1 correction. Asymmetry was defined as the difference between the impacted and non-impacted hemisphere, normalized by their sum. Statistical comparisons of pre- and post-surgical values were conducted using the Wilcoxon sign rank test. Here we show represented maps of cerebral blood flow, arterial transit time, and blood-brain barrier water exchange in a patient before and after cranioplasty. Post-surgical images reveal clear improvements in perfusion and barrier function on the impacted hemisphere, as indicated by the changes in CBF, ATT, and KW asymmetry. After cranioplasty, we observed a significant improvement in cerebral blood flow asymmetry in the MCA perforator territory. Ipsilateral CBF increased with a p-value of 0.003, and asymmetry increased significantly with a p-value of 0.013. In the leptomeningeal PCA territory, both the ipsilateral and contralateral hemispheres showed increased CBF post-surgery with p-values of 0.02 and 0.011 respectively. These findings suggest enhanced perfusion in the impacted hemisphere and improved blood flow across the brain's vascular territories. We also observed a significant increase in blood-brain barrier water exchange asymmetry in the MCA perforator region with a p-value of 0.049. The Asymmetry index shifted from negative to positive following cranioplasty, indicating improved water exchange in the impacted hemisphere relative to the contralateral side. This suggests that cranioplasty may improve microvascular function and BBB permeability, particularly in deep brain structures. Arterial transit time asymmetry significantly increased in the leptomeningeal PCA and ACA territories after cranioplasty. In the PCA region, the p-value was 0.007, and in the ACA region, it was 0.030. These changes reflect a longer arrival time of arterial blood in the impacted hemisphere, which may indicate evolving vascular organization or recovery processes. Together with CBF and KW, these findings suggest a broader restoration of cerebral hemodynamics. When analyzing whole brain averages, cerebral blood flow showed a trend toward increase after cranioplasty, with a p-value of 0.07. However, arterial transit time did not significantly change at the whole brain level, with a p-value of 0.363. These results highlight that regional analysis is more sensitive for detecting post-surgical improvements in perfusion. Whole brain average KW did not significantly change after surgery, with a p-value of 0.332. This supports the finding that water exchange improvements are localized, especially in the MCA perforator territory, and may not be captured in global metrics. Regional targeting appears to be essential for identifying clinically meaningful changes in barrier function. Our results show that cranioplasty leads to measurable improvements in cerebral perfusion and blood-brain barrier water exchange, particularly in the MCA perforator territory. Improvements in CBF and KW asymmetry suggest that regional vascular changes may play a key role in neurological recovery following surgery. The observed increases in ATT asymmetry further support the idea of post-surgical reorganization of blood flow. While whole brain averages showed minimal change, the region-specific findings emphasize the value of targeted perfusion metrics. Overall, these results suggest that CBF and KW asymmetry could serve as promising biomarkers for monitoring brain recovery after cranioplasty and may help guide individual rehabilitation strategies.